everyone, and for today's video, I'll be going to do the head and neck assessment. So before anything else, identify the patient's family and give a name, date of birth, gender, address, medical record number, and your individual healthcare identifier. So please state your name,
My name is Anna Maria Orion.
your age,
I am 18 years old.
okay. When was your date of birth,
June 21, 2000.
address,
San Jose, Boulevard.
do you have any medical record number or individual healthcare identifier?
No.
Okay. Next is, explain the purpose of the head and neck examination and answer any question to the patient. Lastly, perform hand hygiene. So the first thing that we will going to do in the face is inspect the head and then the face for color, symmetry, lesions, and distribution of facial hair. Note facial expression. Palpate the skull. Can you hold this for me, please? Next is inspect the external eye structures like the patient's eyelids, eyeballs, eyelashes, and eyebrows, the cornea, conjunctiva, and sclera. Note color, edema, symmetry, and alignment of the eyes. So far it's good. Next is examine the pupils for equality of size, reaction to light, and light it up to each pupil. Okay. To test for pupillary accommodation and convergence, ask the patient to focus on one of an object as you bring it closer to the nose. So I'll be using this pencil. Please look here as I slowly. Okay. To test the patient's visual acuity with the Snellen chart over here, ask the patient to read the smallest possible line of letters, first with both eyes and then with one eye at a time. So both eyes. Can you basa-basa?
E-L-O-F-O.
Can you cover the other eye?
L-F-D-G-O.
The other eye, please.
F-E-P-L.
Okay, thank you. With the patient about 2 feet away, ask the patient to focus on your finger and move the patient's eyes through the 6 cardinal positions. Follow my finger. After assessing the head and neck, which is the face and the eyes, next I will be assessing the ears. Inspect the external ear bilaterally for shape, size, and lesions. Palpate the ear and mastoid process. Next is perform an otoscopic examination. For an adult, pull the auricle up and back. For the child, pull the auricle down and back. Note cerumen, edema, discharges, or foreign bodies and condition of the tympanic membrane. So next is use a whispered voice to testing hearing. Stand about 1 to 2 feet away from the patient out of her line of vision. Ask the patient to cover the ear not being tested and perform on each other. So I'll be whispering to you, Miss. lastly, use the turning fork to perform Weber's test and Green's test if the patient reports diminished hearing in either ear. Okay. Next is assessing the nose. The first thing that we are going to do is inspect and palpate the external of the nose. Next is palpate lightly percuss over the frontal maxillary cyanosis. Occlude one nostril externally with a finger while the patient breathes through the other. Repeat for the other side. And lastly, inspect the external nostrils using an otoscope with a nasal speculum attachment. Okay. After assessing the nose, I will be proceeding to assessing the mouth. So the first thing is the palpate the temporomandibular joint by placing your index finger over the front of each ear as you ask the patient to open and close the mouth. Perform hand hygiene and don gloves. Inspect the lips, moral mucosa, hard and soft palate, gingivae, open, the teeth, and salivary gland opening by asking the patient to open mouth wide using a tongue blade and pen-like. Next is inspect the tongue. Ask the patient to stick out the tongue. Place the tongue blade at the side of the tongue while the patient pushes it to the left and right with the tongue. Inspect the ovula by asking the patient to say ah, while sticking out the tongue. Palpate the tongue for muscle tone and tenderness. And lastly, remove the gloves. Next is I'll be assessing the posterior neck. In doing that, palpate the forehead and the posterior triangle of the neck and the posterior cervical lymph nodes using the finger pads in a circular motion. Inspect and palpate in front of the behind ears, under the chin, and in the anterior triangle for the anterior cervical lymph node. Lastly, inspect and palpate the left and then the right carotid arteries. Only palpate one carotid artery at a time. And by the use of the stethoscope to osculate the arteries. Using the bell of the stethoscope. Okay, next one. Assessing the posterior neck, the next is the anterior neck. So the first thing that we are going to do is inspect and palpate the trachea. Palpate the thyroid gland. Then if enlarged, auscultate the thyroid gland using the bell of the stethoscope to auscultate the arteries. So far it's not everything together. Next is inspect and palpate the clavicular area. Lastly, inspect the ability of the patient to move his neck. Ask the patient to touch his chin, to chest, and to each shoulder. Move. Chin, head, sige, chin, and anak. Yeah, anak, the shoulder, because shoulder. And then, tip the head back as far as possible. As far as possible. Okay? After doing all the assessment, perform hand hygiene and document the finding of all the assessments from your patient.